President Trump today signed an executive order imposing what he described as hard-hitting new sanctions on Iran. They are in response to the downing of that unmanned U.S. drone last week. The president said that his administration will increase pressure on Tehran until the regime abandons its dangerous activities.
America is a peace-loving nation. We do not seek conflict with Iran or any other country. I look forward to the day when sanctions can be finally lifted. I look forward to discussing whatever I have to discuss with anybody that wants to speak. In the meantime, who knows what's going to happen? I can only tell you we cannot ever let Iran have a nuclear weapon.
These new sanctions deny Iran's supreme leader and his office access to key financial resources. But Iran said today that the sanctions show the U.S. has no respect for international law and order. It is something the energy markets are watching, and today the price of domestic crude did settle slightly higher after last week's huge 9% rally. President of the Dallas Fed says it's too soon to decide if interest rates need to be cut. Robert Kaplan called on his fellow policymakers to be patient and wait and see how economic events unfold. Those events include, of course, the trade war between the U.S. and China, as well as decelerating global growth. President Trump signed a second executive order today. This one pushes for transparency in health care prices. The goal is to lower prices that patients pay. Hospitals and insurance companies say that they will fight this order. Their shares fell in trading today. Bertha Coombs puts it all together for us now.
President Trump's latest executive order is aimed at providing transparency on hospital prices so that patients know what they'll pay before they're treated, not after the fact when they get a sky-high bill.
Patients face significant obstacles shopping for the best care at the best price, driving up health care costs for everyone. With today's historic action, we are fundamentally changing the nature of the health care marketplace.
Earlier this year, the administration required hospitals to post their list prices, but insured patients don't pay those prices. Under the new executive order, the government will require hospitals to make their negotiated insured rates public and require insurers to provide members with out-of-pocket cost estimates for procedures ahead of time. Analysts say the price transparency rules could help increase competition on services like MRIs, where consumers have alternatives and can find scans with lower out-of-pocket costs. But with high-cost procedures like surgery, some say the move could actually backfire.
If this is about a knee replacement or any other kind of surgery, the cost of that is so much higher than your deductible that the deductible is not really a feature of your shopping decision. And then you might start thinking that price is a substitute for quality and you just go to the high price place because you want to go to the highest quality place.
Some analysts worry transparency could also encourage collusion, helping hospitals keep prices sky high in some markets.
The bigger question might be, in the long term, will that drive prices down? Doubtful.
The executive order is just the beginning. The administration now has to draft the rules and give the industry time to comment. New rules on changing Medicare drug price rebates initiated last year still have not been finalized. But it's clear the pressure is on the healthcare industry from Washington and from consumers to do better on prices. For Nightly Business Report, I'm Bertha Coombs.